sharing anecdotal tales and authentic stories to educate and entertain you concerning your options for global health care. Here's America's most unbiased voice for baby boomers, Eileen Little, founder of TravelingForHealth.com.
I'm Eileen Little with Traveling for Health, and what we do is we connect consumers with international providers like Dr. Krishnamurti in India, because we're interested in people learning where the quality doctors are. And I'm calling you because you're a patient, you're a recent patient of Dr. Krishnamurti's. And can you tell me, how do you pronounce your name?
Rajiv.
And how do you pronounce your last name?
Ramath.
Oh, okay, because I have it written down as Rajiv Van Ramath.
Rajiv Van Ramath is my full name. I like to call myself a Rajiv.
All right. So I'll probably also need your help to spell out the name of the operation that you just went through with Dr. Krishnamurti. So what did you have done?
Yeah, that was on 29th of May last month. It's a nasal surgery.
All right.
They use laser technique.
Do you have your paperwork right there?
Yeah, my wife is getting it for me. She's taking it.
Okay.
Yeah, right.
Yeah.
I'm at home. So
where is home?
At the moment, I am in India. I'm here for 2 years, and it's almost finished. I'm going back to the UK. Of course, I am basically from India. Left India some 15 years ago, and went around the world and stayed in the UK for a long time.
Okay.
And came back to India to run a small business. Not small business, a small part of our business.
Okay.
And my term will be finished by end of July, and I'm going back 1st of August.
Okay, where in the UK?
In London. It's near Gatwick Airport.
You've been back in India for 2 years? Is that what you said?
I've been here for 2 years, and I'm going back.
Okay, so the name of the operation is what again?
It's laser turbinoplasty. Is basically opening up in a nasal hole by using laser technology. He cuts some tissues, cut out the tissues. He cuts the tissues such a way that it shrinks away from the nasal hole and opens the nasal hole up.
Okay. So what was the challenge? What caused you to need that operation? What was the problem?
Okay, I had a real problem with nasal blockage in the morning and too much sneezing and coughing and everything.
Okay.
Initially, I thought it's hay fever and went to the doctor. And doctor said, okay, it's hay fever, it's common, just go and have some antihistamine.
Yes.
It went on during winter as well.
Right.
It's not just hay fever, it just blocks completely. It's airtight. In the morning
really?
It will be completely tight. So I thought during winter hay fever is not normal there. So I still went on. The first year I went on with it. Initially in the morning I have a complete block in the nose, and my speaking and everything will go down for a couple of hours, and but it will be okay during during afternoon and all. But still it was a poor quality of life for a few months.
Yeah.
So next year I thought I had to do something, but again they didn't bother much in the UK saying that it's a hay fever because it's quite common. So that's when I thought I should do something about it. But my move from there to India is nothing related to it. But I know when I go out of the UK for a short trip, it will be okay. I'll be completely out of hay fever.
Right.
So it is to do with maybe haze and maybe to the temperature and my nasal problem as well. That's what my current understanding that might happen.
Sure.
So when I moved to India, I didn't have any major problem. I still have some minor block, but I know when I go back to the UK, I will get it back. So I decided to have something to be done about it.
All right.
I thought I should see a doctor. Apollo Hospital is a good hospital, and I heard Dr. Krishnamurti's name from one of my friends.
Oh, okay.
He said there's an ENT specialist. Go and see him. So I thought I would go and see him. So I went and saw him I think it's the first week of May I went and saw him. My initial impression about him was great, and he speak very clear.
Yes.
And his explanations and diagnosis I thought is very convincing.
Okay.
I told him the history of this, and he wrote it down, and he said this could be problem due to hay fever, which you tried and is not working.
Right.
Then he said it could be a growth of tissues, and he sent me large literature which covers a lot of things, and he explained what is in it.
Right.
And he asked me to take a CT scan of nose immediately. So I thought within 5 minutes I went to the CT scan place and got the scan done. I waited there for an hour. Doctor said, okay, this is what exactly he said. He showed me what it is. My nasal hole is very narrower than usual, and he suggested something needs to be done, and that something can be medicines, which he thought I tried, and I too thought I tried enough. And the second is a surgery with using electricity. It can be done, but it's not that effective in the long run. Then third one is that is laser surgery. He said it's a little bit expensive, but it's the best thing he can do.
Okay.
And he said that's more effective than anything else. So I said that's what I want to do, more effective than anything else. And he said that's slightly expensive than the other one. I said that's fine.
Let me ask you something. Did anyone do the CT scan in the UK?
I did not go that far, no.
Okay.
To go to the specialist, basically my GP needs to refer. It didn't go that far, basically it went up to hay fever and, take my own antihistamine from Tesco supermarket. You might have heard of Tesco supermarket.
Sure.
Yes.
So what you're saying is the GP didn't suggest it, and unless you yourself insisted on it, you probably wouldn't have gotten to a specialist?
If I myself insisted on it, I might have got it into a specialist. Okay. It's not bad there, yeah. It's the way it is. It's not a major thing to. That's what they thought. That's what I too thought the first year. Second year, I thought I need to do something.
Okay.
Before that, I arrived in India, and I thought it's better and easy to do here than in the UK, because here I can dictate what I want to do here in India.
So you say you have insurance. Who's your insurance carrier?
International SOS.
Okay, and that's through your company. What company do you work for?
I work for a company called Atkins. It's a big consultancy, engineering consultancy.
Okay, Atkins Consultants? An engineer then?
I'm an engineer here, yes. I was heading a department, now I'm heading projects. Atkins got around 450 people here doing business in India and outside India.
Okay.
Jobs being done from India for UK and for Middle East.
Okay.
And India.
Thank you very much for talking to me. Let me ask you, what was the surgery like as far as pain and recovery, and what's your overall medical experience there?
Okay. Actually, doctor thought it's just 2 hours and I can come in the morning and go back in the evening.
Mm-hmm. Okay.
And but the procedure there in Apollo Hospital is I had to go a day before and get everything tested, like my ECG and glucose and everything else.
Right.
Took a lot of blood from me and tested a lot of things, and tested my ECG, and I think they thought I'm fit enough for the surgery. So next time, that was around 8 o'clock in the evening, I went and joined them, and in the morning, around 8:30, they took me to the operation theater. I think the operation started around 9 o'clock. Few minutes, they put me to anesthesia, and I don't know what happened after that. I know now what happened after that.
Yes.
So around 11 o'clock, I was okay. I got my conscious back, and I had something, not a big bandage, but something stuck into my nose. I could still breathe a bit through my nose. But by around 5:30, doctor asked me to go to his place, and he took that stuff out from my nose. Little bit of blood came out, but not a lot. But after the operation, I came home on the same day.
All right. Okay. All right.
Yeah. The night before was just for the testing. After the operation, evening I came home.
All right. Well, now, how much did the whole thing cost?
I think it is around 80,000 Indian rupees.
Okay, what's the conversion there?
In dollars, I think dollar is around 45 or 47 Indian rupees now, so it's less than $2,000.
Okay, less than $2,000, and of course your insurance probably covered that, which is good. Yeah. What was the result? I mean, how do you feel?
Results so far I feel is really fantastic. I can intake as much as I wish. So the velocity of that is really good. So far so good. I hope when I go back to the UK it will be better.
Yeah, exactly. Well, I would love to hear from you once you get back there.
Yes.
When are you leaving?
1st of August I'm going.
Oh, all right. Okay. So if you can just let me know when you get back to London how you feel, that would be great. All right. Well, I want to thank you for the interview.
Yeah, that's fine. Thanks for your time as well. It's nice talking to you.
All right. Bye.
This interview was conducted as part of our policy to interview a doctor's patients as a follow-up to any article about a provider. We reach out to international providers who have received honors in their field of expertise, can show they have a good reputation with their patients, and are establishing themselves in the medical tourism industry. To hear more about Dr. Krishnamurti, go to travelingforhealth.com and click on the Healthcare Abroad picture to read the article, Medical Tourism, where major U.S. health insurers send their insured.
Thank you for listening to travelingforhealth.com with host Eileen Little. Connect with others on our website where you can ask a question and hear back from people sharing their opinions from all over the world. Requests for interviews or donations in support of our mission are immediately responded to. Our mission is to educate, entertain, and get your voice heard.